Ladies and gentlemen, friends, patients, and everyone watching right now, I want you to stop scrolling for just a moment, because what I am about to tell you today could change the way your brain ages. Not in 10 years. Not in 20 years. Starting today. I have spent decades of my life in clinics, in hospital wards, sitting across from families who bring in their mothers, their fathers, their grandparents, people who once ran households, ran businesses, raised children, remembered every birthday, every recipe, every name. And I have watched, helplessly at times, as the fog of dementia crept in and slowly took pieces of them away. I have held the hands of sons who asked me, "Doctor, is there nothing we could have done?" And for years my answer was heavy, uncertain, full of hedging. But today, my answer is different. Today, I stand in front of you not just as a physician, but as a messenger of something I believe every single family deserves to know. A nutrient, a vitamin, hiding in plain sight, that the growing body of scientific research suggests may help protect your brain, slow cognitive decline, and in some cases, help preserve the very memories that make you who you are. I am talking about vitamin B12. Now, before you roll your eyes and think, "Doctor, I've heard about vitamins my whole life, what's so special about this one?" I want you to give me just the next few minutes, because what I am going to share with you is not hype, it is not a miracle cure, and I am not here to sell you anything. I am here to explain, in plain language, what is happening inside your brain as you age, why this particular vitamin plays such an extraordinary role, what the science actually shows, and what you and your loved ones can do starting today to protect the most precious organ you own. Let me start with a story, because medicine, at its heart, is never just about molecules and lab values. It is about people. Some years ago, a woman came into my clinic with her daughter. She was 68 years old, sharp most of her life, a retired schoolteacher who used to recite poetry from memory. But over 18 months, her daughter said, she had begun forgetting appointments, repeating the same questions within minutes, getting confused in familiar places. The family feared the worst. Alzheimer's, dementia, the beginning of the end. We ran tests, and what we found surprised even me at the time. Her vitamin B12 levels were critically low, not a coincidence, a cause. Once we began correcting that deficiency, carefully, under supervision, something remarkable happened. Over the following months, her clarity began to return. She was not cured of aging, but her mind, which had been slipping through her fingers like sand, began to steady. Her daughter cried in my office, not from grief this time, but from relief. I tell you this story not because every case of memory loss is B12 deficiency. It is not, and I will be honest with you about that throughout this talk. But because it illustrates something profound. The brain is not separate from the body. It does not run on willpower or genetics alone. It runs on biochemistry. It runs on nutrients. And when those nutrients are missing, even the most brilliant mind can begin to falter. So let's talk about what is actually happening inside the aging brain. Because to understand why this vitamin matters, you first need to understand the battlefield. Your brain is, without exaggeration, the most metabolically demanding organ in your entire body. Though it makes up only about 2% of your body weight, it consumes roughly 20% of your body's total energy. Every thought you have, every memory you retrieve, every word you speak, requires an extraordinary orchestration of electrical signals racing along billions of neurons, connected by trillions of synapses, insulated by a fatty substance called myelin that allows those signals to travel quickly and efficiently. Think of your neurons like electrical wires, and myelin like the rubber insulation around those wires. When that insulation breaks down, signals slow, they misfire, they become inefficient. And over time, if the underlying nerve fibers themselves begin to degrade, memories that were once effortlessly retrieved become buried, harder to reach, and eventually, tragically, lost. Now here is where our vitamin enters the story. Vitamin B12, known scientifically as cobalamin, is absolutely essential for the production and maintenance of myelin. Without adequate B12, the body cannot properly synthesize the fatty sheath that protects your neurons. But that is only one piece of the puzzle. B12 also plays a critical role in a process involving an amino acid called homocysteine. Now, I know that sounds like a complicated medical term, but stay with me, because this is important. Homocysteine is a byproduct of normal protein metabolism in your body. In a healthy system, B12, along with folate and B6, helps convert homocysteine into other harmless substances your body can use. But when B12 levels are low, homocysteine begins to accumulate in the bloodstream. And research over the past 2 decades has shown something alarming. Elevated homocysteine levels are associated with brain atrophy, meaning actual shrinkage of brain tissue, particularly in regions responsible for memory formation, such as the hippocampus. Multiple studies, including research published in prestigious journals, have found that people with higher homocysteine levels show faster rates of cognitive decline and a greater risk of developing dementia, including Alzheimer's disease. One particularly striking piece of research, a clinical trial conducted at Oxford University, gave high-dose B vitamins, including B12, to older adults who already had mild cognitive impairment, the stage before full dementia sets in. The results showed that in those with elevated homocysteine levels, the rate of brain shrinkage in those taking the B vitamins was significantly slower than in those taking a placebo. Let that sink in for a moment. Slower brain shrinkage measured on brain scans, not folklore, not anecdote, documented measurable structural preservation of brain tissue. Now, I want to be a responsible physician here, and I want you to trust me, so I am not going to stand here and tell you that popping a B12 pill will cure Alzheimer's disease or reverse dementia that has already progressed significantly. That would be dishonest, and I refuse to mislead you, even if it means this speech is less sensational. What the evidence actually supports is this: correcting a B12 deficiency, especially in those who are deficient or borderline deficient, appears to help slow the progression of cognitive decline, protect brain structure, and in some cases, meaningfully improve symptoms that mimic dementia, but are actually caused by the deficiency itself. And here is the part that should concern every single person listening to me right now. B12 deficiency is far more common than most people realize, especially as we age. Why does this happen? Let me explain the mechanics, because understanding the why will help you understand your own risk. As we grow older, our stomachs produce less of a substance called intrinsic factor, along with reduced stomach acid, both of which are essential for absorbing B12 from our food. This means that even if an elderly person is eating a diet rich in B12, found primarily in animal products like meat, fish, eggs, and dairy, their body may simply be unable to absorb it efficiently. This condition, atrophic gastritis, becomes increasingly common after the age of 50, and studies suggest that a significant percentage of adults over 60 have some degree of impaired B12 absorption. Add to this the widespread use of certain medications, proton pump inhibitors for acid reflux, metformin for diabetes, and other common prescriptions, which are known to further reduce B12 absorption, and you begin to see why deficiency is so much more prevalent than most doctors even test for. And then there is diet. With the rise of plant-based eating, vegetarian and vegan diets, which offer wonderful benefits in many respects, there is one glaring nutritional gap. B12 is found almost exclusively in animal-derived foods. Those following strict plant-based diets without supplementation are at significant risk of deficiency, and I have seen this in my own practice. In patients as young as their 30s and 40s, presenting with fatigue, brain fog, tingling in their hands and feet, and yes, memory difficulties, all traced back to low B12. So let me ask you directly, when was the last time your doctor checked your B12 levels? For most people listening to me right now, the honest answer is either never, or I don't remember. And that, my friends, is precisely the problem I am trying to solve by standing here today. Let me walk you through what deficiency actually looks like, because this is not always obvious, and it is often mistaken for just getting older. Early signs include persistent fatigue that doesn't improve with rest, a strange tingling or numbness in the hands and feet, what we call peripheral neuropathy, pale skin, a swollen or inflamed tongue, and mood changes including irritability or depression. But the signs that concern me most, the ones that bring families into my office frightened and confused, are the cognitive symptoms: difficulty concentrating, forgetfulness, confusion, and in more severe and prolonged cases, symptoms that can closely mimic dementia itself. This is sometimes called pseudo-dementia. And here is the critical point I need every one of you to understand. Unlike true neurodegenerative dementia, this form of cognitive decline caused by B12 deficiency is often reversible, or at least significantly improvable, if caught in time. If caught in time, I want you to sit with those 4 words because they carry enormous weight. The tragedy in medicine is rarely that we lack the tools to help. The tragedy is that we discover the problem too late, after damage has become permanent. A simple blood test, one that costs a fraction of what a single MRI or specialist consultation costs, can reveal whether B12 deficiency might be silently contributing to the memory changes you or your loved one is experiencing. Now, let's talk about the deeper science, because I promised you I would not just give you fear and hope without substance. I want to give you understanding. Beyond myelin and homocysteine, B12 plays a role in DNA synthesis within your cells, including the rapidly dividing cells involved in maintaining healthy blood and nerve tissue. It works closely alongside folate, another B vitamin, in what's called the methylation cycle, a fundamental biochemical process that affects gene expression, neurotransmitter production, and inflammation throughout the body, including the brain. Chronic low-grade inflammation has increasingly been recognized by researchers as a contributing factor in the development of Alzheimer's disease and other forms of dementia. By supporting healthy methylation and keeping homocysteine in check, adequate B12 may help create a biochemical environment in the brain that is less hospitable to the inflammatory and degenerative processes associated with cognitive decline. There is also fascinating research into the relationship between B12 and brain volume itself. A study published in the journal Neurology followed a group of older adults over several years, measuring both their B12 levels and their brain volume using MRI scans. Researchers found that those with lower B12 levels, even within what was traditionally considered the normal range, had smaller brain volumes and performed worse on cognitive tests compared to those with higher levels. This has led some researchers and clinicians, myself included, to question whether our traditional reference ranges for normal B12 levels are actually set too low for optimal brain health, particularly in older adults. I want to pause here and address something important, because I know some of you watching may already be dealing with a loved one who has been diagnosed with Alzheimer's disease or another form of dementia, and I do not want to give you false hope where none exists. If dementia has progressed significantly, if there has already been substantial, irreversible neurodegeneration, correcting a B12 deficiency will not reverse that damage. I will not stand here and lie to you for the sake of a compelling speech. What the evidence does suggest, however, is that maintaining optimal B12 levels may help slow further decline, may help protect remaining healthy brain tissue. And in cases where B12 deficiency is a contributing factor rather than the primary disease process, correction can lead to genuine and sometimes dramatic improvement. This is precisely why prevention and early detection matter so much more than intervention after the fact. The brain, once significant neurons are lost, does not simply regenerate them the way skin or liver tissue can heal. This is why I urge every person listening to me, do not wait until memory problems become severe. Do not wait until a loved one can no longer recognize their own children. Start paying attention now, while prevention and early correction are still powerful tools available to you. So what should you actually do with this information? Let me give you practical, responsible guidance, because knowledge without action is simply trivia. First, if you are over the age of 50, or if you follow a vegetarian or vegan diet at any age, or if you take medications like metformin or long-term acid reducers, I would strongly encourage you to ask your physician for a simple blood test measuring your B12 levels. In some cases, doctors may also check a related marker called methylmalonic acid, which can reveal deficiency even when standard B12 levels appear borderline normal. This is often more sensitive and can catch problems traditional testing misses. Second, be aware of dietary sources. Foods rich in B12 include liver, which is exceptionally concentrated, along with other meats, fish such as salmon and trout, eggs, and dairy products like milk, yogurt, and cheese. For those following plant-based diets, fortified foods such as certain cereals and plant milks can provide B12, though absorption and adequacy should be discussed with a healthcare provider, and supplementation is often necessary and appropriate. Third, and this is crucial, do not simply begin high-dose supplementation on your own without medical guidance, especially if you are elderly or have other health conditions. While B12 is water-soluble and generally considered very safe with a wide margin before toxicity becomes a concern, appropriate dosing, especially for correcting an existing deficiency, should be guided by your physician, sometimes through injections rather than oral supplements, particularly if absorption issues are the underlying cause rather than simple dietary insufficiency. Self-treating a suspected deficiency without proper testing and guidance can mask other underlying conditions and delay appropriate diagnosis. Fourth, understand that B12 is not a solo hero in this story. It works in partnership with folate and B6 as part of an interconnected system. A comprehensive approach to brain health should include not just B12, but an overall nutrient-dense diet, one that limits excessive processed foods and sugar, includes plenty of vegetables, fruits, healthy fats such as those found in olive oil and fatty fish, and adequate protein. And fifth, because I would be doing you a disservice if I implied that any single vitamin, no matter how important, is the entire solution, remember that brain health is built on multiple pillars working together. Regular physical exercise, which increases blood flow to the brain and promotes the growth of new neural connections. Quality sleep, during which your brain literally clears out metabolic waste products, including substances associated with Alzheimer's disease, through a system called the glymphatic system. Managing chronic conditions like high blood pressure, diabetes, and high cholesterol, all of which affect blood vessels supplying your brain. Staying socially and mentally engaged, continuing to learn, to challenge your mind, to maintain relationships and purpose. And yes, ensuring adequate levels of key nutrients, with vitamin B12 standing out as one of the most overlooked, most testable, and most correctable factors in the entire picture. I have practiced medicine long enough to see patterns repeat themselves across thousands of patients, and here is a pattern I want to leave with you today. The people who age with the sharpest minds, who remain vibrant, engaged, and cognitively resilient well into their 80s and beyond, are rarely the ones who found some secret miracle cure. They are the ones who paid attention to the fundamentals, consistently, over decades. They got their blood work checked regularly. They addressed deficiencies when found rather than ignoring them. They moved their bodies daily. They stayed curious and connected. And when something as simple, as inexpensive, and as correctable as a B12 deficiency was quietly working against them, they caught it. Because someone somewhere told them to pay attention. Today, I am that someone for you. I think about the daughter I mentioned earlier, sitting in my office, watching her mother's clarity slowly return after we corrected a simple deficiency that had gone unnoticed for years. I think about how close we came to simply accepting, she's just getting older, as an explanation without ever running that test. I think about how many families out there right now are having that same experience without ever discovering the answer, because no one told them to ask the question. I refuse to let that be the end of this story for you and your family. So here is my challenge to you, as your doctor, as someone who has dedicated my life to protecting the health of the people I serve. Take this seriously. Do not dismiss this as just another health video on the internet. Talk to your physician. Ask about your B12 levels. If you have aging parents, encourage them to get tested. If you or someone you love has been experiencing unexplained fatigue, tingling, mood changes, or memory difficulties, do not simply assume it is an inevitable part of aging. Investigate it. Because sometimes the answer is not a devastating diagnosis. Sometimes the answer is a deficiency that can be corrected, a fog that can be lifted, a mind that can be given back its clarity. The brain you have right now, at this very moment, is the only one you will ever get. There is no replacement, no upgrade, no second copy waiting in reserve. Every memory of your children's laughter, every lesson you've learned, every story you carry from your own life. All of it lives within the delicate, biochemical, and beautifully complex architecture of your brain. Protecting that architecture is not vanity. It is not optional. It is, I would argue, one of the most important responsibilities you carry, for yourself and for the people who love you and depend on you. I know this has been a lot of information, and I have tried to be as honest, as balanced, and as scientifically responsible as I possibly can, because you deserve truth, not sensationalism, even on a topic as important as this one. I have not promised you a miracle. I have shown you a mechanism backed by real research that offers something science rarely gives us: a genuinely actionable, testable, and often correctable factor in the fight against cognitive decline. Before I close, I want to speak directly to anyone watching this who is currently caring for a loved one with memory problems, or who is worried about their own cognitive health. I see you. I know how frightening this journey can be, how helpless it can feel to watch someone you love slip away, or to notice your own memory faltering and wonder what it means for your future. I want you to know that knowledge is power in this fight. The more you understand about what is happening biologically, the more equipped you are to ask the right questions, demand the right tests, and advocate for the right care. You are not powerless in this story. None of us are. If this information has been valuable to you, if it has given you something to bring to your next doctor's appointment, something to discuss with your family, something that might just change the trajectory of your own brain health or that of someone you love, then I have done exactly what I set out to do today. And I want to ask you for something in return, something simple, something that costs you nothing but means everything to me. If this message resonated with you, please subscribe to this channel because there is so much more I want to share with you. More research, more practical guidance, more honest conversations about the science of healthy aging, about protecting your heart, your brain, your body, so that you and the people you love can live not just longer lives, but better ones, sharper ones, more present ones. And please leave a comment below. Tell me your story. Tell me if you or a loved one has experienced something similar. Tell me what questions you still have, because I read every single one, and your questions often shape exactly what I choose to talk about next. Your brain deserves your attention today, not someday, not after a diagnosis, not after it's too late to make a meaningful difference. Today, while you still have the power to protect it. Thank you for spending this time with me. Take care of your mind. Take care of the people you love. And I will see you in the next one.